I kind of have a feeling she wants to be the center of attention when we're all together. She'll notice that we're talking to Allie. Here comes Gigi, like kind of rolling or kind of throwing herself on one of us, or throwing herself on Allie.
Sometimes if Allie's singing, then Gigi will scream like in the middle of her song, like kind of to interrupt her.
Dear Gigi, happy birthday to you.
I know that's her way of saying, hey, I'm here too, guys. Like, include me in the conversation.
She has such a big personality that it's hard to put it into words. I think that she likes to be acknowledged and have people notice her and be around her.
When she's happy, you can tell. When she's not comfortable, you can tell. She will show you. She's got this big attitude in this tiny little body, and it shines through all the time. Gigi started having seizures not long after she was born. I recorded it, sent it to her pediatrician. They could not figure out what was causing the seizures. Her neurologist suggested that we do a genetics panel, and at that time, that's when we got our initial diagnosis.
Bad day for Gigi. A lot of seizures. Just screaming. When you see a tear come down her face, it kills me.
There was a point where she was getting rescue medications every other day. So it was really scary to see her sedated like that, not able to eat or drink or wake her up. Yeah, I'm grateful for good days. Since starting ZTALMY, it's been night and day for us. One of our deciding factors was she was just on so many medications. She'd gone through so many medications and she'd failed so many medications.
With ZTALMY, it just, it seemed like this was something that was actually, helping her. One seizure a day is kind of like a good day for us. It's changed so much. She's up, she's active, she's responsive. We get to just, share things that other kids do, as much as we can, take her to the park, take her to the museum.
Having fewer seizures for Gigi has really meant that we get to enjoy Gigi more as a family. We're able to take her outside of the house more, where she's able to get fresh air and sunshine and then enjoy some of the things that we like to do. If we want to go to the movies or if we want to have dinner, I'm not as scared as before that she's going to have a big seizure while we're out. We didn't know how good it could be until she started having good days.
Having a sister like Gigi has definitely changed me a lot. I'm gonna do this with her, and I'm gonna do this with her, and I'm gonna do this with her. And I'm not gonna make her feel anything less than amazing all the time.
She's just like any other kid. There's tough times that she goes through and she's gonna go through eventually. But that she's just a regular kid. She has emotions, she shows love.
Just the things that she's doing, just the things that she's showing us, her little attitude, and she just makes everybody happy. I'm just so grateful that we're able to have her in our life and that she's showing us how we should be living and just appreciating her and each other every day.
What is ZTALMY? ZTALMY is a prescription medicine used to treat seizures associated with cyclin-dependent kinase-like 5, CDKL5, deficiency disorder, CDD, in people 2 years of age and older. ZTALMY is a federally controlled substance, Schedule 5, because it contains ganaxolone that can be abused and lead to dependence. Keep ZTALMY in a safe place to prevent misuse and abuse. Selling or giving away ZTALMY may harm others and is against the law. Tell your healthcare provider if you or your child have ever abused or been dependent on alcohol, prescription medicines, or street drugs. It is not known if ZTALMY is safe and effective in children under 2 years of age. Important safety information. What is the most important information I should know about ZTALMY? ZTALMY can cause serious side effects, including sleepiness. ZTALMY may cause sleepiness. Taking ZTALMY with central nervous system (CNS) depressants, including alcohol, may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how ZTALMY affects you or your child. Suicidal thoughts or actions. Like all other anti-epileptic drugs, ZTALMY may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider right away if you or your child have any of these symptoms, especially if they are new, worse, or worry you. Thoughts about suicide or dying, attempt to commit suicide, new or worse depression, new or worse anxiety, feeling agitated or restless, panic attacks, trouble sleeping, insomnia, new or worse irritability, acting aggressive, being angry or violent, acting on dangerous impulses, an extreme increase in activity and talking, mania, other unusual changes in behavior or mood. Pay attention to changes, especially sudden changes in mood, behaviors, thoughts, or feelings. Keep all follow-up visits with your healthcare provider as scheduled. Stopping ZTALMY. Do not stop taking ZTALMY without first talking to your healthcare provider. Stopping ZTALMY suddenly can cause you or your child to have seizures more often or seizures that do not stop, status epilepticus. What should I tell my healthcare provider? Before taking ZTALMY, tell your healthcare provider about all of your or your child's medical conditions, including if you or your child drink alcohol, have or have had depression, mood problems, or suicidal thoughts or behavior, have abused or been dependent on prescription medicines, street drugs, or alcohol, have liver problems, are pregnant or plan to become pregnant. Tell your healthcare provider right away if you or your child become pregnant while taking ZTALMY. You and your healthcare provider will decide if you or your child should take ZTALMY while pregnant. Are breastfeeding or plan to breastfeed. ZTALMY may pass into breast milk. Talk to your healthcare provider about the best way to feed your or your child's baby while taking ZTALMY. Tell your healthcare provider about all the medicines you or your child take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. ZTALMY may affect the way other medicines work, and other medicines may affect how ZTALMY works. Do not stop or start taking other medicines without talking to your healthcare provider. Especially tell your healthcare provider if you or your child take alcohol, opioids, antidepressants. Know the medicines you or your child take. Keep a list of them to show your healthcare provider or pharmacist when you or your child get a new medicine. What should be avoided while taking ZTALMY? Do not drive, operate heavy machinery, or do other dangerous activities until you know how ZTALMY affects you or your child. ZTALMY may cause you or your child to feel sleepy. What are the side effects of ZTALMY? See, what is the most important information I should know about ZTALMY? The most common side effects of ZTALMY include sleepiness, fever, excessive saliva or drooling, seasonal allergy. These are not all of the possible side effects of ZTALMY. For more information, ask your healthcare provider or pharmacist. Tell your healthcare provider about any side effect that bothers you or your child, or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or 1-800-FDA-1088. You may also contact Marinus Pharmaceuticals at 844-627-4687. For additional information, please see accompanying medication guide and instructions for use and discuss with your doctor.